So how do we treat it in the shelter? I'm going to talk a little bit about individual animal here. It does respond to antibiotics. What you are treating is the shedding of the oocysts. You do not want to treat titers. You do not want to treat every cat that comes up positive on a blood test. What you want to treat are the cats that come up positive on a fecal test, because you want to treat the shedding and minimize the shedding, because that's what is a risk to your shelter population and to the public. Okay? Clindamycin will shorten the shedding period, and the shedding is the infectious form. It does not clear the organism from the cat. So the cat will most likely have toxoplasma for life encysted somewhere, inactive, just like we do. It does not clear the organism that's gone into hiding in tissues, but it will shorten the shedding period, and that is what we're concerned about in terms of public health. If the animal has systemic disease, it has toxoplasmosis and it's got neurologic signs from it, or muscle signs from it, or problems with its heart or lungs, clindamycin will help with the symptoms, but again, it will not eliminate the organism. So neurologists will treat toxoplasmosis. We treat it, you will treat it with an antibiotic. It's not going to clear it completely, but it will make the animal better. Some of those signs may remain, some of those signs may resolve. But then how are we going to manage that? So let's take it from the individual animal. So pretty easy to be like, yes, cat's got signs of disease, or the cat's shedding. Let's pop it with some antibiotics, and we stick that in our shelter. So now we've got populations of animals that are surrounding that animal, we've got populations of people that are surrounding that animal, and we've got potential adopters out there. We need to manage the poop. So this is pretty key every day in our lives. This is what we do in shelter medicine, is we manage poop. One of the things that's really recommended is to be sure that you're cleaning the feces daily or multiple times before sporulation occurs. Remember, key point, those oocysts are not infective until 1 to 5 days after they come out of the cat. So if we can pick up or eliminate or throw away the poop within that window of time, we're going to have a much better control over that infective form. That may be our most key point in managing this and managing risk. The other issue is disposable litter boxes. These certainly, a lot of shelters are using them, and the nice thing about them is they eliminate that option that oocysts or parasites of any kind are hanging around in the crevices of all those plastic boxes or getting passed from animal to animal. So cardboard disposable boxes are really nice. They can be a little costly, but they certainly eliminate all that cleaning that you're doing with your staff. How many of you use cardboard litter boxes, disposable ones? Okay, and how many of you are cleaning litter boxes and recycling? I would recommend that you at least have disposables for your ill animals, the ones that are having diarrhea and that sort of thing, because you really don't want to contaminate plastic litter boxes that you then pass around. And so at least for that, but disposable litter boxes can go a long way to trying to help with this. The other thing is we've gotten very fond of spot cleaning. How many of you are doing spot cleaning? And probably you've heard me talk about it because we're all advocates of it in terms of cleaning to minimize stress in our cats. But one of the issues with spot cleaning is that we're just kind of scooping the box and then leaving some stuff behind, right? So we may be leaving oocysts behind that can sporulate. And so again, disposable litter boxes could help with trying to eliminate some of that. The other thing to know about this is those oocysts are super, super tough. They are resistant to your standard disinfectants. All right, basically you need a flamethrower. I don't know how many of you are cleaning with boiling water, but I am not. In order to kill them, you basically would need something hot enough to scald your hand. So that doesn't work out very well. Steam will kill them, but your basic cleaners will not. 10% ammonia might kill them, but it'll probably kill everything else in the shelter, including you. So I don't recommend that either. They need moisture, and so dryness kills them. We don't exactly live in a dry climate. So when it comes to these oocysts, we are challenged. We'd be better off in a desert. Drying the spaces, completely drying the spaces will help. And sometimes it's just scrubbing and rinsing more than anything to eliminate. Dilution is the solution to pollution, right? Just wash those suckers away as much as you can. And I think the biggest thing is prevention, is being one step ahead of the game, getting rid of the feces in a timely fashion, educating your staff, and I'll talk about that too, in terms of trying to prevent the parts of this cycle. So if we can prevent this part, then we feel a little bit better. There's not much we can do about people that want to eat bleeding meat. They have to worry about themselves. They can do that at home. and not in our shelter. And certainly if you have a rodent problem in your shelter, and I know some of you probably do because I've been in some places that have some pretty difficult rodent situations, this is certainly one of the risks of increasing this in your shelter. So deal with your rodents one way or the other. It's not always the best thing to be offering your shelter cats live diets.